Hermes, the quick and cunning messenger of the gods, the protector and patron of thieves, as well as business and travel. And at Sketchy, the patron god of herpes. In this scene, Hermes will once again embody that unrestrained, fleet-footed, and frustratingly recurring spirit as the mascot for Hermes Airlines. At the Hermes terminal, we are going to cover acyclovir, valacyclovir, and famciclovir, oral nucleoside analogs used for the treatment of herpes simplex and varicella zoster infections. Just remember that they have similar mechanisms of action and comparable indications for clinical use. Make sure you completely empty your pockets before passing through. And for your convenience, we have some recycling bins in the front here. A recycle bin has been used previously in our Sketchy Micro course to represent acyclovir, so we're bringing it back, just for a little reminder. Let's head first to the Hermes Airlines check-in counter, where you can check your luggage while I highlight acyclovir's mechanism of action. Notice first that the luggage kind of resembles a nucleoside, specifically the purine guanosine, as indicated by the posh G pattern on her bags. That's brand name stuff. Okay, we get it. You're flying first class. Thanks for the reminder. Remember that acyclovir is a guanosine nucleoside analog that gets converted to acyclo-GTP before getting in there and putting a halt to viral DNA polymerase. And because it's a nucleoside, not nucleotide analog, it needs to get converted before it can be incorporated into viral DNA, phosphorylated 3 times to be exact. Acyclovir is first converted into acyclovir monophosphate via virus-encoded thymidine kinase. This is an important distinction because this occurs selectively in virus-infected cells. The subsequent phosphorylation steps are then taken over by cellular enzymes. When your nucleoside luggage is ready to go, the Hermes attendant first slaps on that bag tag. Notice, it's marked with a P, representing the first phosphorylation step. Notice, too, that the airline attendant is fully decked out in Hermes attire. This is to highlight that a virus kinase, like the one produced by herpes viruses, performs this first step. As the bags move down the conveyor belt, a second and third phosphorylation tag gets added to the luggage as it passes the security checks, but these workers are dressed in their usual blue-collar uniforms, just your typical cellular kinases. Now, as acyclovir triphosphate, it can readily compete with deoxyguanosine triphosphate for viral DNA polymerase. Notice that these odd-shaped bags are getting into a jam at the junction in the conveyor belt, messing up the flow. This junction represents viral DNA polymerase. Take a close look and you'll see that the single conveyor belt has a DNA helix design which splits into 2 equal double-stranded helix paths, just like DNA-dependent DNA polymerase. When acyclovir triphosphate gets incorporated into replicating viral DNA synthesis is terminated, just like this jam of nucleotide bags. Remember, acyclovir does not significantly impact uninfected cells. See that herpes-evoking Hermes attendant? That first step requires viral phosphorylating enzymes. Also, acyclovir is not effective against CMV or EBV because the first phosphorylation step involves a specific herpes virus-encoded thymidine kinase. This is the rate-limiting step in the activation of acyclovir. To highlight this, we have a sign indicating a rate limit of 1 checked bag per traveler. This rate-limiting thymidine kinase step is also where herpes virus can gain resistance to acyclovir. Because nucleoside analog antiviral drugs must first be phosphorylated in order to function, the absence of this thymidine kinase in a herpes virus strand confers resistance. This will be represented by the absence of a Hermes air attendant at the closed baggage check. No acyclovir luggage is going to make it through, right? Well, there is someone who can get through the closed checkpoint. Someone with special access who doesn't need the first phosphorylation sticker on his bag. SID, the Cidofovir security officer. Cidofovir does not require that first phosphorylation by the viral kinase and can therefore be used in acyclovir or ganciclovir resistant HSV and CMV infections. It is phosphorylated and activated solely by cellular kinases. This may be especially important in immunocompromised patients. Thymidine-deficient strains of VZV, for example, are almost exclusively found in patients with AIDS and can be treated with cidofovir. See his special access badge? The P indicates that he's already phosphorylated and can pass through the closed checkpoint with ease. Let's have him pulling up his own VIP luggage to the closed phosphorylation checkpoint in a car. Net. Phoscarnet, that is. It's a little luggage car with a net. Just like cidofovir, Phoscarnet is not activated by viral protein kinases. In fact, it does not require intracellular activation at all, making it useful in acyclovir or ganciclovir-resistant HSV, BZV, and CMV infections. Notice how it too passes through the closed checkpoint with ease. No phosphorylation sticker necessary. The mechanism of action of cidofovir is to directly inhibit the viral DNA polymerase. Similarly, Phoscarnet is a pyrophosphate analog that selectively inhibits the pyrophosphate binding site on viral DNA polymerases. Since both agents directly inhibit viral DNA polymerase, we'll make our security officer with his CarNet rushing towards the shutoff sign to put a direct halt on the DNA polymerase conveyor belt. And of course, mutants with alteration in viral DNA polymerase may be resistant to Phoscarnet and cidofovir. Let's return back to acyclovir, valacyclovir, and famciclovir, which all effectively treat HSV. A short course of treatment with oral therapy, usually 7 to 10 days during primary oral or genital HSV infection, helps pretty much everything. It reduces the duration of viral shedding, time for lesion healing, and local pain. This acute treatment, however, does not seem to reduce recurrence rates. Patients who present with multiple yearly episodes of recurrence can be offered daily suppressive therapy. Acyclovir, famciclovir, or valacyclovir can be used, though daily oral valacyclovir is often preferred as it is dosed once per day and has superior bioavailability. Take a look at the entrance. See the valet parking area? This represents valacyclovir. Notice that the sign reads frequent flyers and daily rate in order to highlight daily suppressive therapy for recurrent HSV. Valacyclovir is an acyclovir prodrug with better oral bioavailability, and while we'll make the valet attendant's mouth wide open as he tosses in a snack, notice how the sign on his booth says available with upwards arrows indicating this increased oral bioavailability. Let's talk a little bit more about acyclovir, the only one available for IV use in the United States. On the column in the left side of the scene, let's sketch in the Hermes airline mascot depicted in this statue. IV is extending up the statue, representing IV administration. IV acyclovir is the treatment of choice for herpes simplex encephalitis, neonatal HSV infection, and serious HSV and BZV infections. Remember that red hemorrhagic winged helmet from our sketchy micro Herpes Hermes sketch? Well, here it is again on the IV-covered statue, representing herpes encephalitis treated by IV acyclovir. We've also included this cute little Hermes airline flyer to represent IV treatment for neonatal infection. Remember, too, that acyclovir, valacyclovir, and famciclovir are all effective therapies for herpes zoster. Herpes zoster infection manifests as the shingles hemidermatomal vesicular rash because of reactivation of varicella zoster virus. Our sketchy symbol for herpes zoster is the Greek god himself, Zeus. And here he is again on this poster underneath these shingles, advertising some bargain vacation packages. With all those rival airlines out there, Hermes Airlines has fallen on some pretty rough times. So to attract business, Hermes Airlines is now offering an amazing deal on a 3-day family vacation to Greece. Take a look at the poster. The words value and family are there to remind you of valacyclovir and famciclovir. They are usually preferred over acyclovir because of superior activity and less frequent dosing. During an active shingles infection, these drugs can decrease symptoms of acute neuritis and hasten resolution of cutaneous lesions. They are most effective if given early, within 3 days of onset of symptoms. Hence, the 3-day vacation package. Of note, while these drugs have been shown to treat the more acute symptoms of herpes zoster, their ability to prevent post-herpetic neuralgia is unclear. Alright, it's going to be a long flight, so why don't we grab something to eat really quick over at the snack stand? You know what? This is kind of weird, but that prepare for your flight sign is kind of reminding me of prophylaxis for herpes infection. This can be especially important in immunocompromised patients who may experience more severe symptoms or rapid progression of neurologic complications. This includes patients with AIDS, as represented by the elderly, cane-ridden lady behind the counter, our recurring sketchy symbol for immunocompromised states. Also, agents such as acyclovir or valacyclovir can be used to prevent reactivation of herpes viruses after hematopoietic stem cell transplantation. See that kinda gross looking yet somewhat appetizing organs on ice? This is our sketchy symbol for transplant, of course. HSV prophylaxis can be important during pregnancy. In pregnant women with active recurrent genital herpes, it's recommended to start suppressive acyclovir therapy beginning at week 36 to reduce the risk of viral shedding at delivery and possibly the need for cesarean section. Let's talk side effects. So, the airline industry has gotten pretty strict about the stuff you're allowed to take with you on a flight. That prop sword from the movie Lady Hawk? Sorry, son. And that exact replica of the cane weapon from Blind Fury? Not gonna fly! You know what? No Rutger Hauer memorabilia in general. Okay? Notice that before the travelers are allowed through the security checkpoint, they must empty their bags of any sharp objects, placing them into a sharps container that's vaguely kidney-shaped. This represents the renal impairment caused by IV administration of acyclovir. Specifically, it can cause interstitial nephritis or a crystalline nephropathy, highlighted by these sharp, crystal-shaped objects, leading to tubular obstruction. These renal side effects are uncommon, however, with adequate hydration and a slower infusion rate. Everybody knows, no liquids allowed into the terminal. So next to the kidney sharps container, passengers quickly finish their prohibited beverages. Last thing, all these drugs can cause delirium, confusion, vertigo, and hallucination, especially with high doses and IV administration. And just look at that kid who set up the alarm in the metal detector. He looks pretty disoriented, highlighting these uncommon CNS side effects. Alright, let's sum up this sketch. Acyclovir, valacyclovir, and famciclovir are guanosine analogs that are used to treat and prevent HSV and VZV infections. They are first phosphorylated by a viral thymidine kinase as depicted by a Hermes attendant putting on that first luggage tag. Then cellular enzymes take over, leading to a triphosphate form that halts viral DNA polymerase. Drugs like cidofovir and foscarnet can bypass this first phosphorylation step and directly inhibit DNA polymerase. They are effective in treating resistant strains. Our valet guy in the back highlights the increased bioavailability of valacyclovir, as well as its use in suppressing annually recurrent herpes infections. Acyclovir can be administered IV to treat neonatal and other serious herpes infections, including herpes encephalitis, as represented by our IV-adorned hemorrhagic Hermes helmets. On the advertisement poster, Zeus represents all that is zoster, including valacyclovir and famciclovir's effectiveness in treating shingles, especially if used within 3 days of the onset of symptoms. Our flight prophylaxis station highlights suppression therapy for immunocompromised and pregnant patients, and at our security checkpoint remember to keep crystalline nephropathy and central nervous system effects in mind. Well, we hope you enjoyed your flight on Hermes Airlines. Please put your tray tables in the upright and locked position, put away any large electrical devices, and in case of an emergent hemorrhagic encephalitis, please supply your own IV acyclovir before assisting others.